Good evening all. So basically the topic of my today's presentation is gender disparities in the prevalence of undernutrition in India, the unexplored effect of drinking contaminated water. It's a joint paper with my supervisor, Dr. Khushboo Aggarwal. So to begin with, I would like you to look at some statistics which is being given by UNICEF, according to which more than 2,000 children under the age of 5 die every day due to water-related diseases. Now, India alone accounts for 24% of world's total child mortality. In fact, as per the recent report given by World Health Organization, states that in India, the major cause of morbidity, especially among children under the age of 5, is mainly due to the lack of accessibility to safe drinking water. Now, there have been several studies which try and focus the effect of environmental degradation on several child health outcomes. Amongst these studies, some of the studies that have tried to focus on impact of air pollution on infant and child health in developing nations are such. So, for instance, a study by Boyle and Canning show that how the elevated levels of air pollution would actually create a negative impact on a fetus health and would also lead to negative impact on several child indicators in Bangladesh. Now, another study by Foster and others in 2009 shows that how a clean industry certification programs actually leads to lower level of air pollution, which might in turn lead to lower incidence of respiratory diseases amongst the infant in Mexico. Now, there has been several work which has been done in India related to water pollution. So, for instance, a study by Du and others in 2018 shows that how the environmental regulation according to which there should be a lesser discharge of industrial pollutants in river Ganga has actually led to improved health outcome for infants. Similarly, another study by Brainerd and Menon in 2012 states that how the discharge of fertilizers in river has actually impacted the pregnant women, especially during the month of conception, and that has led to a very harmful impact on the health of the infant, especially when it comes to neonatal mortality. In fact, the further it also studies that how a prolonged exposure to such water contamination actually leads to reduced height for age and reduced weight for age amongst children in India. Now, when we talk about environmental degradation, one of the major emerging issue is the quality issue which is being reported due to the groundwater contamination as witnessed by the presence of several toxic metals, for instance, presence of arsenic, iron, nitrate, and fluoride. But this paper would mainly focus on arsenic and its health impacts. So when a region has presence of arsenic beyond the threshold limit, which is 50 micrograms per liter. So basically this limit has been given by World Health Organization. So when a region has the prevalence of arsenic beyond the threshold limit, then people who are consuming such contaminated water would have severe health implication. Amongst those health implications, some of the short-term impact are vomiting, diarrhea, abdominal pain, muscle pain, skin rashes, and a prolonged exposure to such contaminated water would actually lead to several fatal health outcomes, such as cancers of urinary, then respiratory diseases, and other neurological diseases. Now, there is a huge literature for adults that tries to analyze how does exposure to arsenic actually leads to poor health outcomes for adults, but there has been very less studies which try and analyze the negative impact of having arsenic exposure to arsenic on the child growth measure and their nutritional status, especially for the children who belongs to the age group of 0 to 5 years. Now, as you can see in this diagram, basically the red zone, especially in the areas like Bihar, UP, West Bengal, Assam, shows that the prevalence of arsenic is basically beyond the threshold limit, which is again 50 micrograms per liter. Now, as I've already shown, that the major reason is actually the Ganga Brahmaputra basin, but the reason has not been established as yet. Now, unlike other studies which actually tries and argue that the presence of arsenic in a region is basically a natural occurring process, but this is not true, as in this study we argue that the presence of arsenic is mainly affected by several anthropogenic activities like intense exploitation of groundwater and intense usage of fertilizers. Now, apart from drinking water, food is the other channel that leads to arsenic intake by human body. Arsenic in India has affected millions and millions of lives, but the majority chunk of arsenic affected patients stays in areas like Assam, Bihar, West Bengal. Now, the reason for choosing children as a sample analysis lies for the fact that arsenic has a disproportionate effect on children due to their weak or the lower immunities, their underdeveloped bodies, and have higher water requirement relative to their body weight. Now, the negative effect of arsenic gets worsened further for the children who belongs to the family who has income constraint or belongs to the family who have economic performs low in terms of economic indicators. Now, in this study, we argue that in the presence of gender bias, girls are actually more likely to get affected by arsenic exposure, mainly the girls who are born at later birth order in the family. Now, the medical literature argues that arsenic is the only metal which has the property that it can pass through placenta and can affect the fetus. But these studies by Caspian and others also states then that it can be avoided if mother breastfeeds the child, the infants, for a longer duration, as arsenic has the property that it cannot pass through breast milk. But when girls are provided an inadequate amount of breastfeeding or are given inadequate nutrition during their early childhood, then that will make them less immune. As a result, they will be more susceptible to arsenic exposure. And this is more severe in case of girls who are born at later birth orders. Now, basically what we try to do in this study is that we try to examine the impact of environmental pollutant, say arsenic, on stunting and underweight amongst the children who belongs to the age group of 0 to 5 years. Although there has been several studies which try to analyze the impact of gender discrimination, which is mainly measured by unequal parental investment on child health in India, particularly the girls who are born at higher birth orders. For instance, a study by Jayachandran and Pandey in 2017 examines the variation in provision of prenatal and postnatal health inputs across birth order gradients. Their findings suggest that during the pregnancy, parents tend to give more amount of prenatal inputs to the pregnant women, but after the delivery of the child, especially if the born child is a female, then there seems to be a reverse pattern in allocation of postnatal health inputs, such as lower duration of breastfeeding is provided and lower accessibility to services like vaccination, etc. is being provided. Now, there has been another study which also tried to suggest that mothers with no son or fewer son and who wants to conceive again, as their desired level of number of children, a number of son in the family has not yet achieved, then they would want to conceive again. As a result, they would limit their breastfeeding durations for the newly born daughter. Thus, such inadequate resource allocation to girls would actually increase their vulnerability to the environmental pollutants and in thus would affect their mortality rates. Now, the identification challenge that we face here is that unlike other study which tries and argue that presence of arsenic is actually a natural occurring process, but it is not true, since the intensity of economic activity in a region is actually correlated with arsenic concentration level. For instance, the area which are rich in agricultural activities, those areas tend to use more of groundwater so as to irrigate their field. As a result, there is lowering of water tables, and thus there is higher concentration of arsenic levels in those regions. Now, to tackle this challenge, what exactly we do in this analysis is that we use the variation in soil texture across the district so as to instrument for the arsenic presence of arsenic in that region. Why? Because there has been literature which tries and argue that there is a inverse relationship between the presence of arsenic in a region and the permeability levels of soil. As you can see in this diagram, that there is a positive and a strong correlation between the presence of arsenic in groundwater in a region and the presence of clay soil, which is measured in terms of percentage in that region. So there is a strong and positive correlation between these variables. Now, a small preview of our main results. Higher concentration of arsenic exposure is actually associated with higher level of stunting, which is measured by height for age, and higher level of underweight, which is measured by weight for age. Now, the negative effect of arsenic gets intensified further for the girls who are born at later birth orders. These effects get exacerbated further in the regions where the sex ratio is in favor of males as compared to females. This is mainly again due to several patrilineal Hindu kinship practices. Now, the adverse implication of arsenic would actually be higher for the people who belongs to Hindu community as compared to the Muslim households and the households who are located in rural areas. So the possible explanation might be due to the nutritional disadvantage that a female child has to face during her early childhood days. Now, for this analysis, we have taken the data from the recent round of NFHS, that's 2015-16. Here, our main outcome variables are height for age, which is used to measure stunting, and weight for age, that's for which is used to measure underweight. Now, apart from that, we have control for several background characteristics, maternal characteristics, and other socioeconomic indicators. Along with that, we have host of several district-specific characteristics, such as the presence of other contaminants, climatic factors, economic indicators, literacy, monthly per capita expenditure. Along with this, we also have data for arsenic or the presence of other contaminants from Central Groundwater Board. We have taken the district level information on district level variables from Census of India 2011. Now, the data on soil texture is basically extracted from a software known as Harmonized World Soil Database software. Now, in this study, the parameter that we have taken for choosing a state as that we include only those states in our analysis where at least one district has arsenic beyond the threshold limit. Accordingly, we have in our final data sets, we have 9 arsenic affected states and 261 districts, which further gets classified into 105 arsenic affected districts and 156 non-arsenic affected districts. Now, the descriptive stats for our main variables. As you can see that in our sample, the mean level of arsenic is 107.32 micrograms per liter, which is much higher as compared to the threshold limit which is being given by World Health Organization. This is the descriptive stats for our other control variables and also for the district level characteristics. Coming to our OLS framework. So basically here our outcome variable, as already mentioned, is the health outcome of child I who belongs to district D and state S. Here a main explanatory variable is the level of arsenic that is present in a district and that varies within a state. Apart from that, we have included several individual and family background characteristics along with several district specific characteristics. And we have included state fixed effects in all our regressions. Now, as I've already mentioned before, that due to the presence of arsenic not being exogenous, we argue that our OLS would suffer from endogeneity issue, and thereby we rely on instrumental variable framework. But before getting into instrument results, I would like you to see first on OLS estimates. So here, when we try and run the regression separately for girls and boys, then we find that increase in level of arsenic by 1 unit would actually lead to decrease in height for age by 0.003 standard deviation. And although the effect is actually small, but though significant as compared to boys. Now coming to weight for age, we don't find any difference across girls as well as boys. Now, coming to our IV framework, as I've already mentioned that there is a inverse, there's a positive correlation. Thus, we use the variation in fraction of clay soil texture across the districts within the same state to instrument for arsenic contamination. So this is our first stage, and these are our first stage regression results. So as you can see that our first, because our first stage is quite strong, so our instrument seems to be a quite strong instrument. Now coming to our results on IV, here we run a regression again separately across gender. As you can see that our OLS estimates were quite small, so it was actually severely downward biased, unlike our IV estimates. So here we can argue that the presence of arsenic does not have a differential impact across girls and boys separately. This holds consistent for height for age as well as weight for age. So further, we try to analyze that whether the health outcome will actually vary by gender and birth order or not. So here in this regression framework, our main interaction here, our main key interest variable is the three-way interaction between arsenic girls and second child and arsenic girls and third child plus higher. So second child basically is an indicator for child I whose birth order in the family is second. Now this variable third child is basically an indicator for child I who is born at birth order third or maybe born at later birth orders, later than third. Along with this, we again account for several individual maternal and family background characteristics, and along with several district specific characteristics and state fixed effects. Coming to our results, so as you can see, when we talk about the OLS estimates for height for age and weight for age, we don't find any effect of arsenic on both of them. But when we talk about our IV estimates, so I'm talking about column 3rd and column 6 per se. So we find that when the level of arsenic increases by 1 unit, then it would actually lead to decrease in height for age for girls who are born at second birth order and for the girls who are born at third birth order by 0.015 standard deviation and by 0.046 standard deviation respectively. The effect seems to be quite significant. Again, when we talk about weight for age, then we find that increase in level of arsenic by 1 unit would actually create a higher impact on weight for age for the girl who is born at third birth order and might lead to decrease in weight for age Z-score by 0.041 standard deviation. So thus we can argue that actually the presence of arsenic exposure would lead to decrease in height for age and weight for age amongst girls who are born at third or later birth orders. But there has been study which tries and argue that a child who is born at later birth order also belongs to a higher probability that the child will belong to the family who has a large family size. Now, due to the high family size, a household will not be able to allocate proper resources to each child. As a result, it will affect the child's health outcome further. So, to control for the endogeneity issue related to family size, we try and instrument the presence of family size by the variable as gender of the first child, where the gender of first child is actually a binary variable which takes value 1 when the firstborn child is a female and takes value 0 when the firstborn child is a male. Now, after accounting for family size as well as birth order, what we can see, so here we have run the regression separately for girls and boys. So what do we find here in column 1? We see that the increase in presence of arsenic would actually lead to decrease in height for age for the girls who belong to the third birth order. And similar effect is being found when we see for weight for age, that's column 3rd. But as compared, when we try and compare these results for boys, then we can see that the effect is actually 3 times higher for girls as compared to boys. Now, this seems to be a consistent pattern for height for age as well as weight for age. Now, what is the reason why girls are being at a higher birth order are actually worse off? This is primarily, mainly, probably this is because of the siblings rivalry effect, which states that having an older brother could limit the availability of essential nutrients along with other health inputs to the later born daughters in the family. And this, there has been suggestive evidence which actually try and support the argument of differential resource allocation. Now, we also tried to examine the heterogeneous impact of arsenic. Our first result 5 shows that the heterogeneous effect of arsenic by sex ratio, where sex ratio is a district level variable which is taken from census data 2011. Here we have used the value 922, that's the median sex ratio in our sample. So we don't find much effect in case of height for age. But when we talk about weight for age in column 3, we find that the presence of arsenic actually has a negative effect on weight for age, especially for the girls who are born at later birth orders. This effect seems to be absent for the districts where the sex ratio is in favor of females as compared to males. Now, next set of results, here we try and classify sample on the basis of religion, where we see that the first column where we report the results for Hindus, we see that the presence of arsenic actually leads to reduced height for age Z scores, especially again who are born at later birth orders. The effect seems to be consistent for weight for age amongst the girls who are born in the Hindu family. This is primarily because of the several patrilinear or patrilocal practices that is being heavily followed by Hindu community, as unlike for the Muslim community. Now, our last set of results mainly classify a sample on the basis of rural-urban status. Again, we can see that the presence of arsenic would actually lead to reduced height for age Z score, especially for the girls who are born at later birth order. And unlike for the girls who are born in the urban areas, the effect holds true for the weight for age Z scores as well, as the presence of arsenic has actually significantly reduced the weight for age Z score for the girls who are born at later birth orders. Now, to conclude, I would like to say that this paper is a fresh attempt to try and study the link between gender, environmental pollutant like arsenic, and child growth measures. We find strong and negative effect of contaminated water on height and weight of girls, especially the younger ones. Now, the effect is possibly it's due to the nutritional disadvantage that a female child has to face due to the parental discrimination that she has faces during her early days of childhood. The adverse implication of arsenic gets intensified in the areas with worse sex ratio, Hindu households, and rural location. This again might be due to the prevalence of social cultural norms that have inclination towards patrilineal kinship or patrilocal practices. Now, the accessibility to safe drinking water is a major issue and has affected life of millions, especially in the developing nations like India, where the overexploitation of groundwater has led to a higher level of contamination and is actually adding to the cost. Now, there have been several water related policies which has actually tried to reduce the burden of diseases, but still the lower immunity of the girls would remain a challenge. Now, as per the recent statistics which are being issued by NFHS 5, shows that there has been an emerging crisis of stunting, and there has been an issue of contaminated water. Now, given this global pandemic that has actually affected all the incomes of all sections, especially the poor ones, which has actually taken a toll on their quality accessibility to quality nutrition. So the government should try and implement such policy which tries to address such issues, and there is a urgent need to implement such policies in the states where regressive socio-cultural norms prevails a lot. Thank you.
Thank you, Khushboo, for an excellent presentation. I would request now Nidya to discuss the paper. So you're ready with your presentation, Nidya?
Yeah, I'm here. So
Okay.
I think I might need to, Khushboo, you might need to unshare your slide.
Yeah, I'll just. Is it fine now?
Just a second, let me just try.
I think we're still seeing your slides, right?
Can you see, hold on. Can you see mine now?
Yeah.
Yes, we can.
Okay.
Thank you.
Let me just make this full screen. All right. Okay, so let me just begin by thanking Farzana and Nalini and Soumya and the other organizers for the opportunity to be here and for the chance to read this interesting paper. So Khushboo, that was a really nice presentation, very comprehensive. You should look at my comments as given in the spirit of making something that's already strong even stronger. Okay, so I'm going to be sitting in the chair of a future referee and kind of thinking in using those lens and trying to help you support the kinds of things that you're saying so that it jumps all the initial hoops that you might have to jump through. Okay, so let me get going. So the summary over here, as I understand it, is that it studies the impact of arsenic in water on height for age and the weight for age of children in selected states of India, which is 9, and then there's a breakdown by districts. Some districts have arsenic, others don't, and importantly, these are nine states of India. Whenever there's an instrument, so it uses soil texture as an instrument for prevalence of arsenic. So I'm just going to say right here that whenever there's an instrument, it's an easy target. And so the aim of the paper and the comments that I'm going to offer from the next slide onwards are in some sense trying to bolster the instrument, okay, and make sure that it satisfies the various things that, things like the exclusion restriction and so on. So let's get to that. What do we find here? Well, we find that the impact of arsenic is similar, right? When it comes to boys and girls in terms of magnitude. But when you disaggregate this by birth order, it's the girls of higher birth orders that are more negatively impacted. And then these results are amplified, right? In regions where you have unfavorable sex ratios among Hindus and in rural areas, which are all as we expect for us who work on India and on health issues in India. Okay, so just to kind of couch this in very broad context, my understanding here is that it impacts girls and boys equally, but the negative impacts are more evident in girls of higher birth order because of all these additional insults that they suffer, right? Summing from sun preference. So the manifestation of arsenic is amplified and is more evident in girls because of all these other things that we know happen to children in specific parts of the country. Okay, so let's focus on the instruments. So the percentage, so what you're using here is the percentage of clay soil in the district as the instrument for the presence of arsenic. So the first thing I'm going to offer here is you want to make a very strong case for your instrument. Once you've done that in the paper, then everything else just sort of automatically follows, right? There's no more questioning of, is this valid? Is this correct? And so on. So this is where you want to focus the bulk of your analysis in some sense. So let's look at the first thing that we know instruments need to satisfy, which is relevance. So there is a literature going back to Eliana Carranza's work from 2014, and you cite this in your paper as well, talking about the fact that girls are more valued in areas with more clayey soil, right, relative to loamy soil. And that's something that you need to tackle head on, I would say, in this paper, because it's contrary to what it is that you're showing. The other thing that you need to acknowledge is this well-known north-south gradient, right, that we, when it comes to women's and girls' status in the Indian context. And so my understanding is that, women are, for example, more in rice cultivation in the south and the eastern regions, particularly because the proportion of clayey soil there is more suitable to rice, right? All of this is relative. And so the north tends to be more loamy, which is wheat, and then you go back all the way to, Esther Bozrup's arguments from 1970, talking about the fact that, where women's labor is valued, their status is relatively more. We know that loamy soil is not suited to female cultivation, and so there's these wide omitted variables that you'd need to think about in this particular context, right? So more specifically, and I should have put this figure in here, but this is the figure that you showed with the arsenic map, highlighting that in regions of Uttar Pradesh and Bihar and West Bengal and Assam, these are the areas where clay soil is particularly of a higher percentage and presence. And so that's where you expect to see more arsenic, right? That's the instrument that you're using. And so there's this dissonance between what we know from the literature about women's status and this presence, and my understanding that clay soil should be relatively more in the south, which is where the revealed preference of rice cultivation happens, right? Because that's more suited to growing rice as opposed to growing wheat. Okay, so that's the first thing, which is this making this case that your instrument is actually relevant in this particular context. Okay, and the only southern state that you have here is Karnataka. We can talk about that a little later. Okay, so the second thing here that I want to kind of emphasize is in terms of making a stronger case for the instrument is this exclusion restriction, right? It's not clear to me, and perhaps it's just my reading of the paper, but you need to make it really, really watertight and very transparent in the paper, that the impacts on the relative value of women's labor in agriculture, and so on their status, does not independently impact child outcomes, okay? Given what I've said in the previous context. So I think the NFHS is very, very good for anthropometrics and all the other things, but it's not very good when it comes to labor supply, especially in terms of hours and wage data, right? So you want to, if possible, you already supplement this with sources, from the Water Board and so on, but try to get better data on wages and labor supply to try and tackle this head on, right? So do we see variations in terms of labor supply on these various margins that I've been talking about, and really strengthen the case that the impact of arsenic is working on child outcomes only through the presence of the instrument, right? Conditional on presence of the instrument, there's nothing further. Okay, and the second thing I kind of wanted to emphasize in that particular figure is that, you highlight UP, Bihar, etc., which we know coincides almost exactly with regions in the country where outcomes are worst, right, for women and for children. So if you can leverage additional variation, that would be super helpful in this context. My understanding, I haven't worked on arsenic, but my understanding is that arsenic in groundwater is spatially concentrated. So you can have within the same district, you can have neighboring villages where one village or even certain wells in that village have arsenic contaminated water, and in that same village, other wells don't. Okay, so this trying to getting it, into a more narrow context would help. So consider using the widely used close borders methodology along all close distances along borders in a treatment control framework to provide additional support. That would be one suggestion. There's also new techniques now, coarsened exact matching methods that would allow you to kind of balance your treatment and control groups more closely. So we know that what we're measuring is only arsenic and not a whole ton of other omitted variables that can matter. Be careful when you do the CEM, because when you're matching, the sample sizes are going to decline a lot. And so that might automatically play into precision, but these are in some sense robustness checks for what you already have in the paper. Okay. All right. Consider doing falsification tests, which would be highly useful and which is widely done, right? So what do we see in regions in terms of higher order girl outcomes where there's more loamy soils? Check for omitted variables, right? So especially mother controls. I didn't see you using many of the things that the NFHS already has and which any referee would look for. So sources of drinking water, sanitation, because that's so huge, right? Given Dean Spears and Dan Coffey's work, infrastructure, etc. in these models. And I would kind of, just step back a little bit and say, this is not just an arsenic story per se that kind of ties you to these instruments, right? This could have been any environmental pollutant. This could have been any insult. The case that you're making here is that, things happen, equally bad things happen to boys and girls, but we're seeing them manifest themselves much more in girls because of these wider things that, girls in particular, especially younger girls in particular, suffer, right? And if that's the point that you want to get across, then there's these additional things that you can sort of rely on, which is, are the impacts weaker if the child was nursed relatively more, which is tying into Seema's work, right? Are the impacts weaker if it's all girl families, for example, or of higher birth order? There's a typo over here. There should be higher birth order. And then, are the impacts weaker if the mother is reporting that the gender composition of her children is close to what she would consider as ideal, right? So there are these other things. So I think you want to kind of frame this in the context of a lot of bad things happen in developing countries, and given these additional insults to girl children, especially younger girl children, these are being manifested more, and this is less so of an arsenic story. It could have been exposure to PM 2.5 or whatever it is, right? I also have a bunch of smaller suggestions which I can get to. I know we're out of time, so I should stop talking. But I think some of the key things that you want to think about is when you put in, district fixed effects, since your instrument is at the district level, I'm not clear how all of this is being identified. And so you want to be a little bit careful there. So I'll stop.
Thank you, Nidya, for a very, very comprehensive discussion on the paper. Khushboo, I think we are out of time, but as a chair, I have a small question, which is sort of general in nature, not specific to your paper, but to these papers on birth order. That, what I noticed was, and I want to know, do you control for birth weight? And then I'll ask the question.
Birth
Yes.
weight. No,
Yes.
I don't control for birth
You
weight.
see, one of the biggest challenges I have with these papers is that I looked at Rohini's paper as well. Unfortunately, birth weight is one of the biggest predictors of stunting, wasting, neonatal mortality, and infant mortality, right? I mean, it's in the medical literature, it's all there. And not controlling for that has a huge impact on the result. And I'll give you the logic for it. So think of it from a first birth baby. Let's say, it was a low birth weight baby. And let's say the mother didn't realize the risk and the baby has almost 4 to 5 times higher odds of dying, right? Now, in the second, let's say baby, the second order baby, let's say the mother does realize the risk and takes all the precautions. But this is a low birth weight baby, right, which survives, which is something that you can measure. You sort of, the stunting and wasting can only be measured on babies that have survived. So now you would say typically, because the first birth babies were removed from the cohort, they could never be measured, you would typically find a higher level a lower level of wasting and stunting for the first order. But in the second order, without controlling for the birth weight, you would typically find that babies would be of lower, higher stunting and wasting. Not because things have changed because of the order, it's just that the risk has been addressed or internalized by the mother, right? So, because you see, there is a survival bias in terms of measuring the first and the second order effects, because you can only measure the height and weight of babies that only survive, right? So I was looking at Rohini's paper also, but most of these papers typically do not control for birth weight. And so my question is, if you were to control for the birth weight of the baby, right, I would be curious to know, because I have seen previous papers that have been published in top journals like the Lancet. The results have completely reversed the moment you put in the birth weight of the baby, because that's the risk factor which matters for all outcomes typically related to children, right? So it's medically been proven. We don't know how the causal factors are, but we know it is one of the risk factor that is associated. So I would urge you to sort of control for this factor, because you do have birth weight data. Unfortunately, one of the worst thing in the NFHS is, which is what again is the data which the paper uses, Rohini's paper uses, is that birth weight data is not very well recorded precisely for those states where she would be expected to find the bias, right? So UP, Bihar is precisely, even in the NFHS data, you would be surprised to know that 60% of children's observations, typically it will be written, birth weight not known, right? So now, we don't know whether the baby, or it's called an unreported birth weight. So now in those states, we are not very sure that is the birth order effect happening due to just the weight of the baby, or are there some, or it's really the factors that what these papers are trying to say. So I would urge you, at least in your paper, to sort of control for birth weight and then see what the effects are. I think could be very, very meaningful to sort of look at the effect of arsenic, because I think that would be because there is a survival bias in all of this, right? If the baby had not survived due to arsenic, poisoning, then there's no question of you measuring the baby. But if it's arsenic that is leading to low birth weight babies being born, but let's say in India, somehow low birth weight babies survive, at a higher proportion, you could have this paradoxical effects. Simply once you put in the birth weight effects, then a lot of these, it'll be interesting to see then what the magnitude would be. It could even actually strengthen for all you know. Okay, so that'd be one suggestion of mine, because that data is easily available.
So we'll definitely try this. Thanks for the suggestion. We'll definitely try this out.